Okay, so when you assess the respiratory function of a newborn or a neonate, you want to inspect their chest and their throat and their face. So in inspecting their chest, you want to look again for symmetry, make sure both sides are equal. You want to look to see if they're retracting, so to see if they're actually sucking in, if there's actually retraction between the ribs, if there's retraction underneath the ribs. And then you also want to look at their face. If they have nasal flaring, a little bit is not really a big deal. It's kind of normal, but a lot of nasal flaring is a problem. And then you want to look again for color. You want to look to see if they have circumaural cyanosis, which is blueness around the nose and mouth. Again, acrocyanosis, which is blueness of the nails, fingers, and toes, is normal in a newborn. Lasts for a couple of days, but blueness of the mouth and the central area of the body is not normal. They are abdominal breathers, so that is okay. Their diaphragm is what they use to breathe, so that is actually very normal. So you want to look also and inspect and listen for stridor, because that means that their throat, their airway is compromised. So that's like a very, very, very noticeable sound. And then you also want to auscultate, and you want to listen for the sound of their breathing. So if you only hear it on one side, that's indicative maybe of a pneumothorax or like severe atelectasis on one side. So you want to note that if it's only on one side. And you also want to note the rate of breathing. So neonates, the rate is 30 to 60 breaths per minute. So it should be somewhere in between there. If it's over 60 and they're very tachypnic, that's something that you want to note. They're definitely in distress. And if they're really, really high, also they're at risk for a pneumothorax. So you want to note that. Periodic breathing, which is when they breathe, and then they stop breathing and they're apneic for a little bit, is quite common. So it's not something that's really, something to note that's serious, but you do want to make note of it just in case they're apneic for a long period of time. And then babies also are noted for shallow breathing, where they just breathe very, very, very lightly. But when that happens, they're not taking deep inspiration. So you want to note that. Coarse sounds are very, very common, especially babies that are born via C-section. They have a lot of fluid in their lungs, so that you may hear initially. And then you also want to note babies whose moms are on mag sulfate, because their respirations could be very, very depressed. So you want to note things like that.